Do you want to know the different technologies that can take really good pictures of your insides? Well, today on our video, we're actually going to be talking about the differences between an X-ray, a CT, and an MRI.
So if you like this video, please subscribe to our channel, hit the like icon and the bell notification to let you know anytime we have a new video up. So let's get on with the show.
So we're going to talk today about the three different types of modalities that we just mentioned, the imaging modalities. So you have X-rays, which are the first one. Yep. And as chiropractors, those are the ones we like because it gives us a lot of information. Now, X-rays come from ionizing radiation, exposure to ionizing radiation. And we have an image receptor behind you, so it exposes it onto that image or that receptor, and then we have the image from that. And it'll show mainly bone, so bony tissue, because just the way we calibrate it, that's what we want to see. You can get X-rays obviously for your chest or for your abdomen. Those are slightly differently calibrated, so you can see a little bit more of the soft tissue. But for the most part, when you're getting an X-ray, it's for bony structures, and you won't really see any soft tissues. Sometimes you might have a shadow of an organ or a muscle, but that's about it.
Now with X-ray, the one thing you are seeing is you're seeing you in real time posture. Yeah. So you're standing straight up. So it's actually getting a look at what you look like in real life, as if, how you are standing. So as chiropractors, that's huge because it gives us an idea of how your posture is and if there is actually any degenerative areas that we need to worry about or we're concerned about. So this is a good example of an X-ray and some of the X-rays we take here in the office. And so as you can see, there's a lateral cervical X-ray. So the person is facing this way. Actually, the person is me.
It's him, yeah.
That's my X-ray.
It's his X-ray.
And so what we actually see is we see all the white bones. So you can see some of the tissue. You see a little bit of whiteness. So even though it's designed for bones, you do absorb some of the ionizing radiation in your tissue, and that's why that comes up. And so that's why we can actually see some of that. But it basically allows us to see how the bones are actually looking.
Yeah, gives us the structure of the bones. And then for us as chiropractors, the important thing that we're looking at is the joint spaces, because we want to see that. If, a radiologist would read the X-rays, they would read it completely differently because we're looking for completely different things. So we always really, even if you get X-rays somewhere else and bring them to us, we always need to read them ourselves because we're looking for very specific things.
We're not very interested. We're not interested in the report. We're interested in actually looking what the real X-ray looks like. Yeah. Now, one thing I like to talk about when I always discuss X-rays with my patients is the technology of X-ray hasn't really changed in the last 100 years as far as the tube that makes the X-ray. Yeah. That has stayed pretty close to the same, but the thing that has changed is the technology that actually reads the X-ray. So to produce an X-ray like we're seeing right here takes a fraction of the amount of ionizing radiation that it took even maybe 10, 15, 20 years ago. So absolutely. Technology has advanced as far as the amount of safety and how much radiation we're actually exposing patients to. So
which is awesome.
Super, super safe. A lot less X-ray, and we get great information. Yeah,
really important information for us.
So for the next technology, we're going to talk about CT scanning. And what CT scanning is, it uses the same ionizing radiation that X-ray does, but instead of taking one picture, you basically takes thousands of pictures. And so you sit into basically a large enclosed area, and the X-ray tube will actually go around you, and it takes a spiral picture of your body. And it takes a picture every centimeter. So every centimeter gets a slice of you. And so all of these images basically get put together with a computer and it produces an image.
Yeah, which is pretty cool.
Yeah. So because of that, it actually is more, you get more detail than you would with an X-ray. You get to see some bone. You do see some soft tissue. You get to see some organs. You get to see a lot of different things with it because of the amount of information that they're able to gather by having this thing continually go around you. Yeah. So basically when you get the pictures, you get it in different ways. You get slices, either up or down, front to back, sideways, or even a cross-sectional cut. And so a doctor or a surgeon can actually, take these CT pictures and figure out what slice or what area they want to look at and kind of get to a real specific area. So it can be very, very beneficial if they're looking for something like a tumor or...
Yeah. So for us as chiropractors, CTs do also give us a little more information. I mean, we can see if we get a CT scan of a section of your spine, we can see the nerve roots, we can see if the bone, like how the bone is moved, we can see bone spurs, if they're, you know, impinging on the nerve roots. I mean, we see so much information, really. Will it change how our care plans or how we treat a patient? Not necessarily, like, because x-rays give us so much information. You know, yeah, it's a bonus to see CT scans, but just from the x-rays alone, we can get a significant amount of information so that we're able to create a good care plan for you as a patient.
Now, the drawbacks that we do have CT, because you always have to look at risk-benefit, is because it's ionizing radiation, you are getting a lot more exposure to X-ray. So you have to really weigh out the benefits of finding this information versus the risks of being exposed to more X-ray, right? Yeah. Which is a huge, important factor to take into consideration. And the second issue is you're lying down. So you lose any postural distortions or shifts that you might normally have. Because you're lying down and you just don't see it, right? Because things relax, curves flatten out, or maybe even accentuated, you know, depending on your postural change, right? So you're actually not getting a true vision or idea of what your true posture looks like. Which again could affect you positively or could affect you negatively.
So the third and final imaging modality that we're going to talk about is MRI. Which is magnetic resonance imaging.
Tongue twister.
A tongue twister, yeah, a little bit of tongue twister. So with MRIs, what is great is you don't get the ionizing radiation that you would from an X-ray or a CT scan. And it uses a big magnet, basically, to help line up the ions in your body. And, you know, depending on how they vibrate, it knows what, you know, if it's a soft tissue or a bone or a muscle or whatever, and that information goes in the computer and you see those images, and it gives us a really clear picture. It gives us a lot more information about what's going on in the body, which can be really beneficial, especially for medical doctors who are looking for diseases, right? So that can really help for them.
Absolutely. So because of that, you get a lot more information. The difficulty is there are some challenges with it is you do have to go into a very tight space. It's a lot more closed in than CT. So people who have claustrophobia or who have panic attacks, who have high anxiety, oftentimes they have to be sedated before they have this test done, or they may not be able to have the test done at all. So that is a factor. And there's a lot of people who have it, myself included, who don't think they're claustrophobic, and
until you're in that tube,
and then you realize you do have a claustrophobia issue.
That's it.
So that can be a factor for some people.
Yeah, and you have to be in the tube for such a long period of time as well
to actually get the vision, to get the visual
images.
The second thing really is if you have metal in your body too as well. For example, if you're a tool and die maker and you've been working, or a mechanic, oftentimes you may not qualify because you have lots of metal embedded in your skin. Or if you have a replaced hip, knee, shoulder, whatever, any metal
Plate
in your body,
in your head.
plates in your head.
Something like that.
Sorry, MRIs ain't for you.
Not going to happen. So
Not
CT scan would be used in that instance, depending on what they're looking for, right?
Absolutely. And so even if CT may not be the most optimal for you, you're going to have to go that way.
Yeah, that's it. And with the same thing with MRI as CT in a sense is you can have different windows. So with the CT scan, you can see bone, but you can also see organ tissue. With MRIs, you have two windows. You have a fat window and you have a water window. So the fat window shows you adipose tissue, so fat tissues and fatty deposits in the body. But the water window, I like it because it shows inflammation, so areas of inflammation. So if you have a disc issue, if you have even just a small fracture, like a stress fracture, you can pick these up on MRIs where the other modalities wouldn't necessarily show.
Or unless it was bad enough, right? It has to be
at a significant
level to be picked up by CT. or even more significant level to be picked up on X-ray. So sensitivity does change depending on what you're looking at.
Yeah, absolutely.
Yeah.
And here we just have a few MRIs just to give you an example of what they look like, and it looks kind of weird actually.
Yeah.
And so this one here is a T2 window, which is the water window. And so the spinal fluid, so your cerebral spinal fluid, which surrounds your spinal cord, is bright white. So you can see if there's bone impinging on that, then you can see, so you know the bone is actually probably poking your spinal cord, which is probably it's not the good thing, right?
Not a good thing.
And this is the T1 window, which is the fatty tissue window. So fat tissue will show up bright white. So you see, the tissue under the skin, the fat under the skin, fatty deposits in the body, and etc. So yeah, it gives you really cool information.
Very neat.
Yeah, it's really neat. That's it.
So a couple things that I want to talk just in the last to kind of tie it all in is there's a few things that we need to keep in mind when we talk about these different technologies. Number one, the more advanced technology doesn't necessarily mean the best technology. It'll be the best thing for you. Every case is different, and just because MRI is really cool and it shows a lot of stuff may not necessarily mean that that's the best one for you, because oftentimes you can, for the most part, most diagnoses can be made with just using plain X-ray. Yeah. And so leaving the CT and the MRI for the more advanced or more definitive diagnosis is probably a better bet.
Yeah.
And secondly, the question I always get is patients always ask, well, should I get an MRI or should I get a CT extra on top of this, or should we get some more X-rays? And technically speaking, for the most part, imaging usually doesn't change the care plan for the most part and the outcome. So for example, if we have a diagnosis and we know what it is and we're very certain that, for example, you're dealing with arthritis, it's a postural issue, maybe even a herniated disc, getting that extra imaging doesn't necessarily mean that you're going to get better faster.
No.
In many ways, it slows things down because some patients like to discontinue care until they find out for sure what it is, right? And for the most part, that diagnosis can be made with the doctor, with the chiropractor, with just some very simple tools that we have, and from X-ray that we have, that we use at our disposal. So yeah, so having this technology doesn't mean that you're going to get better faster.
No.
So it's an extra thing that we have, which is good to have, but it's not necessary to get better.
That's it.
And lastly, the third point I just want to make, just to kind of clear things up, is every test has positives and negatives, right? Like we talked about before.
Yeah.
You have to, to be able to do each of the tests, you have to outweigh what's good and what's bad for it. You know, for example, if you have metal, you can't do MRI, you have to do CT. If you want to get to see a structure, but you don't want to be exposed to the ionizing radiation, plain film is better, or maybe MRI is better. So you have to outweigh, there's a positive and negative for each one, and every person's different, and so you have to take that into consideration. Yeah.
Well, there you have it. That is our video on X-ray, CT, and MRI. What the differences are, what we're looking at as chiropractors. Thanks again for watching, and if you can, please subscribe. That would be amazing. Hit the bell icon so that you can be notified every time we post a video. As well, give us a like. Let us know you like videos like these, and share, right? Share with family members, anybody you feel could benefit. And also leave us a comment and let us know if you have any more questions about MRI, CT, or X-rays. Let us know. We'll get back to you as soon as we can. Now, coming up next, we have a really awesome video. It's all about hips and hip X-ray, and if you can actually diagnose hip arthritis just from an X-ray. So click here, go there right away. That's up next.
Good to know.